We continue our lecture with the next bacterial infection that affects gastrointestinal tract, and it will be cholera. Cholera is caused by Vibrio cholera, which is a gram-negative bacillus. Under microscope, this bacillus looks like curved bacillus. The main reservoir for this infection will be humans, but also Vibrio cholera can multiply in the fresh water supplies in the seawater, so contaminated water also can be a source of infection. Infection usually can be seen in warm climates, Asia, South America, Africa. You have to remember that cholera is one of the life-threatening GI tract infections. And there's a phrase that actually describes cholera. It says the first signs of cholera in the morning, corpse by the evening. That means we can lose our patients with cholera within 24 hours. What is the main cause of death in this case? It's going to be dehydration, severe dehydration. Causative agent of cholera is enterotoxin, which is an exotoxin that is produced by Vibrio cholera. So basically what it does, it stimulates epithelial cells of mucous membranes of GI tract to secrete a lot of water. And usually patients with those fluids lose a lot of electrolytes as well. And that is main cause of death in elderly patients, immunocompromised patients, and children. Symptoms of cholera: sudden nausea, abdominal pain, vomiting, severe diarrhea. Actually, the stool of those patients has very specific look. We call it rice water stools. Why do we call it rice water stools? Because that stool is clear, looks like water, with the pieces of mucus from gastrointestinal tract, and those pieces of mucus look like pieces of rice. Of course, for the treatment of cholera, we're going to use antibiotics. For example, tetracycline can be a drug of choice. But probably the main part of the treatment will be rehydration. We have to replace lost fluids as soon as possible in any possible way. So basically, if patient is not vomiting, we give that patient to drink fluids, plus of course we introduce fluids intravenously with electrolytes. So rehydration therapy will be the main part of treatment of cholera. Next bacterium that also can cause gastrointestinal infection is Vibrio parahemolyticus, which is gram-negative, slightly curved bacillus. It causes gastroenteritis, and infection is very similar to cholera but not as severe. So it's a mild kind of like cholera infection. The source of infection will be seafood products, contaminated food. And as I said, symptoms of this infection will be similar to cholera but not as severe, and it is an example of self-limiting GI tract infection. The next infection is caused by GI tract infection that's caused by Yersinia enterocolitica. Once again, it is gram-negative bacillus. Infection is relatively new, and what you have to know specifically about Yersinia enterocolitica is this bacterium grows at the room temperature, and it also can grow in the lower temperatures. So basically we keep our food in the refrigerator so we keep them from spoiling. But as I said, Yersinia colitica will grow at the room temperature pretty well, and it will continue growing in refrigerator. The source of infection will be contaminated food, water, and domestic animals. Yersinia enterocolitica causes enterocolitis with abdominal pain, Actually, the symptoms of infection are very similar to symptoms of appendicitis. And today, surgeons believe that a lot of appendectomies were actually not necessary, because actually there was this infection, GI tract infection, caused by Yersinia enterocolytica. Clostridium difficile, or C. diff. Once again, as you remember, all Clostridium species have the four main characteristics. All of them are gram-positive bacilli. All of them are anaerobes. All of them have ability to form endospores, and all Clostridium species can produce toxins. And if infection is caused by Clostridium species, the causative agent is always going to be toxin. Now, Clostridium difficile. Clostridium difficile is an example of opportunistic bacterium from human GI tract. So it's a part of normal biota. Usually patients develop symptoms of what we call pseudomembranous enterocolitis, which is caused by Clostridium difficile, when we use broad-spectrum antibiotics for treatment of certain bacterial infections. Broad-spectrum antibiotics are usually very strong antibiotics, and they have ability to kill normal biota of GI tract coliforms, which are very sensitive. But since Clostridium difficile is a very resistant bacterium, it will not be killed, it will survive, and it will start producing toxin, and patients as a result will develop symptoms of, as I said, pseudomembranous enterocolitis. The main symptoms of this infection will be a stubborn, very distinctive smelling diarrhea. Usually this infection affects elderly patients and patients with immunocompromised immune system. And for treatment of this infection, we're going to use antibiotics. For example, vancomycin can be a drug of choice. Peptic and duodenal ulcer. For a long time, we believed that ulcer is caused by a stressful life. Today we know, yes, this is one of the factors that can actually cause ulcer, because stress causes spasm of capillaries that supply mucous membranes of gastrointestinal tract, and as a result those mucous membranes become prone to inflammatory reactions. But actually the main cause of peptic ulcer is a bacterium which is called Helicobacter pylori. Helicobacter pylori is a very small gram-negative bacillus. And when patients get infected with Helicobacter pylori or H. pylori, most of those patients will develop chronic gastritis, inflammation of the mucous membranes of stomach, and as you see, up to 20% of those patients will eventually develop ulcers. So the question is, how does Helicobacter pylori adjust for living in such a low pH environment, such an acidic environment? First of all, Helicobacter pylori doesn't grow on the surface of the mucous membranes. It actually grows under mucous membranes of the stomach area. Second, this organism has ability to split urea and form CO2, carbon dioxide, and ammonia. By doing that, it creates more alkaline environment around itself. To diagnose this infection, today we use diagnostic or serological tests. We're looking for presence of antibodies to H. pylori in the patient's serum. And for the treatment, we're going to use what we call complex or combined treatment, when we use 3 antibacterial drugs at the same time. Staphylococcal food poisoning is caused by Staphylococcus aureus, which is a gram-positive coccus in clusters. Staphylococcal food poisoning is #1 food poisoning in the United States. And the causative agent of this infection will be enterotoxin that is produced by Staphylococcus aureus. The source of infection will be contaminated food. For example, on the bottom of the slide you see a few examples: bakery goods, dairy products, processed meats, potato salads. And the symptoms of infection will be nausea, vomiting, abdominal pain, diarrhea. It is a self-limiting infection, brief infection. Patients usually recover within few days. Clostridium perfringens. One more Clostridium species for you. And Clostridium perfringens, this is another example of opportunistic bacterium because it can be found in the GI tract of humans and animals. Once again, Clostridium species gram-positive bacilli can form endospores, anaerobes, produces toxin. The source of infection of this infection usually is cooked meats and gravy, and usually those products are a source of infection in restaurants, because as you remember, in the restaurants usually chefs keep the gravies under heating lamps or on the warmers, on the surface of the warmers, to keep those that gravy warm. If that gravy is not cooked long enough, and it means endospores, which might get there, are not killed, then as soon as that gravy is placed on the surface of the warmers or under heating lamps, endospores will start growing, start producing toxins, and people eat it and develop symptoms of food poisoning. It is another example of self-limiting infection. Usually patients recover within a couple days.